After a demonstration project by the Ministry of Health and Program for Appropriate Technologies for Health PATH in Nakasongola and Uganda districts, the Ministry of Health, supported by MAC MSD, had a pilot project in 14 districts to determine the effectiveness of administering the HPV vaccine against cervical cancer in about 140,000 girls using Gardasil. Dr. Robert Mayanja, the Program Officer for the National Expanded Program on Immunization, UNEP, says the ministry is now ready to roll out the program countrywide.
And we are targeting 887,000 girls, 10-year-old girls, because we want to ensure that the girls have not engaged in sex.
Uganda will become only the second country in Africa to protect girls nationally with Gavi-supported HPV vaccines.
This vaccination of girls who are not yet sexually active will go a long way in turning the tide against the cancer, which kills almost all women who get it. On a global scale, the WHO says 530,000 new cases are reported globally each year. Of these, 270,000 die of the disease. In Uganda, of the estimated 3,500 cases reported each year, about 2,500 die.
Largely caused by human papilloma virus.
Some of the risk factors include multiple sexual partners, having sex as early as 16 years when body tissues are very delicate, tobacco use, immune suppression, for example, in HIV-positive people. Dr. Judith Ajani, a consultant obstetrician gynecologist at Mulago National Referral Hospital, says 80% of the beds in the gyne cancer ward are occupied by cervical cancer patients. Of these, up to 90% come with late-stage cervical cancer.
The cancer has spread very far to the areas surrounding the cervix to involve other organs like the bladder and the rectum, so the patients cannot be operated and they are subjected to some other form of treatment called radiation.
The country, however, has only one radiotherapy machine, making the wait for treatment longer.
Some patients who do not have damage to their kidneys by the cervical cancer disease, they are also given chemotherapy. Chemotherapy is a form of treatment using cancer drugs that are very toxic, and they are given into the veins.
So prevention is critical, and for anyone who has already been sexually active, a checkup is your best option. At Mulago Hospital, it's free. In private hospitals, you may have to part with between 30,000 shillings to 300,000. The process takes not more than 10 minutes, and you'll only come back for results. It's a little bit intrusive, but it's worth it. Florence Nalimba, NTV.